Welcome back to the Deep Dive. Today we're looking at something maybe a bit unexpected, medical dramas.
Right, but not just any medical dramas.
Exactly. Forget what you usually see. We found some, research suggesting they could actually be a big part of future surgical training. We're diving deep into the pedagogical power these shows can have, but only when they really focus on, real anatomy and the actual clinical consequences.
This is a fascinating angle.
So our mission today is basically to figure out that formula. How do you blend the tension of cinema with hard clinical facts to make something that genuinely teaches? Okay, let's unpack this.
Well, what's really fascinating here is the core idea they call the anatomy of consequence.
Anatomy of consequence.
Yeah, it's not about random accidents. It's very specific. It's about dramatizing a known, maybe rare anatomical variation that then directly causes a specific, unexpected complication during surgery.
Okay, so it links cause and effect very directly. The source material calls this approach both a cautionary tale and a teaching tool, which makes sense.
Precisely. It's designed to really hammer home how critical precision is.
And maybe more than that.
And more importantly, the real human cost when you just assume anatomy follows the textbook, when you don't consider those variations.
Right. Okay, so how do they make that stick? Is there a structure?
There is. They propose this very systematic 5-step structure for each episode. It's designed to be modular, adaptive.
5 steps, okay.
So the first 2 are really about setting the stage. You start with number 1, the cinematic hook.
Like a tense moment.
Exactly. A high-stakes scene in the OR, maybe a flash forward to the crisis brewing. Get the suspense up.
Okay, hooked. Then what?
Then step 2, the backstory and anatomy setup. Here's where they introduce the patient and, crucially, that specific anatomical variation.
How do they show that? It could be complex.
Yeah, and that's key. They use adaptive visuals, think 3D models popping up, or specialized overlays on screen, maybe even stylized in-painting, whatever makes the deviation crystal clear.
Got it. So you see the problem before it becomes a problem in the story.
Exactly. It plants that seed. But the real learning pivot happens in step 3, the surgical decision point.
The moment it goes wrong.
Or the moment it could have gone right. It highlights precisely when the surgeon in the story maybe missed the variation or misinterpreted an image or just underestimated the risk involved.
That sounds like the core teaching moment, almost like a simulation.
It absolutely is. That decision point forces you, the viewer, to engage. You're thinking, what would I do? Did they see it? It leverages that tension.
So it's not passive learning.
Not at all. It cements the anatomical fact through, active cognitive rehearsal driven by the drama.
Okay, and then step 4 must be the fallout.
Step 4, complication and consequence. And this is important, they stress, focusing on the emotional impact, the ethical questions raised, the physiological cascade.
Rather than just blood and guts.
Exactly. Not cheap gore. The focus is on the resonance, the human cost. That high emotional stake helps make the lesson permanent.
Makes sense.
Yeah.
And the final step.
Step 5. Debrief and teaching moment. This is where you get, say, expert commentary, maybe a voiceover, clearly explaining the variation again, its implications, how to avoid that complication in real practice.
So a really solid structure. But I imagine the style, the feel of the show matters too.
Hugely important. The source insists it has to be drama first, not gore focused.
Right. Emphasizing the ethical complexity.
Yeah. And they use techniques like camera angles that mimic a surgeon's actual point of view. It pulls you right in, makes it feel real, immediate.
Okay, so structure and style work together. Now, you mentioned specific examples. That's where it gets really interesting, I think.
It does, because these aren't just made-up scenarios. They showcase rare but real high-risk situations.
Give us one.
Okay, so they have one called the phantom nerve. This deals with the non-recurrent laryngeal nerve during, say, a thyroidectomy.
Okay, I know that nerve's usually in a predictable spot.
Usually. But non-recurrent means it's taking a completely different path. It's hidden. If the surgeon assumes the standard path and doesn't actively look for this variation...
Uh-oh. Vocal cord paralysis?
Bingo. A direct link. Specific anatomical variation leads to a specific, severe consequence.
Wow. Okay, what else?
Another one. The hidden curve. This involves an aberrant right subclavian artery.
Meaning the artery isn't where it should be.
Right. It takes an unusual path. So a routine procedure, maybe guiding a central line catheter using standard landmarks, suddenly becomes incredibly dangerous. You risk perforating the vessel.
Because the map in your head is wrong.
Exactly. Your standard anatomical map fails you.
And there was one more.
Veins of deception. This is about a persistent left superior vena cava.
Okay, sounds complex.
It means the main vein draining the upper body hasn't formed in the typical way. Imagine discovering that midway through setting up for cardiac bypass surgery.
That would be.
A critical moment. So you see the value, right? These dramas make abstract anatomy tangible, unforgettable. They link it directly to high-stakes consequences, even professional failure.
Yeah, it's learning through consequence, essentially.
Precisely. The knowledge isn't just from a book. It's delivered through this sort of lived, dramatized consequence, often wrapped in ethical reflection.
Which brings us to a really interesting point.
It does. It raises a pretty important question for you, the listener.
Yeah.
If this kind of powerful educational drama really depends on using real, anonymized medical cases ethically, how does this blending of art, cinematic drama, and real-world medical data actually change professional education at a fundamental level?
That's definitely something to think about. So what does this all mean?
Well, it suggests the future of learning complex skills, like surgery, might actually look more like, well, compelling television than a traditional lecture.
A fascinating possibility. Thanks for joining us for this deep dive.